I would like to continue with my presentation rather, and it will all be in the context of the case that Anjali has presented. So I'll talk about the disparities in heart disease in men versus women, what we can do about, and finally I will end with a special movement which will give us an incentive to come in a particular dress next time. I believe the same session was there last year, but now when we have it for the third consecutive year, we'll dress in a particular way. Yes, it is very serious. Usha has already clarified that, and this is the leading killer of women of all ages. Metabolic syndrome also is more deadly in women as compared to men. We have data from India, from the CUPS study, that cardiovascular disease is more prevalent in women as compared to men. Why is this so? Amongst the known risk factors, Usha has just told you about gestational diabetes. Polycystic ovarian syndrome is also extremely important. If you look at the trends in CVD mortality, this is known for quite some time. As far as the differences in men and women, much more in women with diabetes as compared to men, with the lowest survival rates for diabetic women. Diabetes per se is a CV risk factor. It is the #1 risk factor for heart failure in women. And if you add hypertension to that, it can only get worse. If we look at all the factors combined, increasing risk for heart failure in women with heart disease, look at the impact of diabetes, renal insufficiency, as well as obesity. The waist circumference is one very important denominator which we look into because it only worsens the situation. In other words, that is obesity. Are we just talking of diabetes or pre-diabetes as well? Yes, it doesn't get any better. It only gets worse with addition of pre-diabetes. And these differences have been seen at the endothelial level before conversion to pre-diabetes. A very elegant study which showed the differences in these endothelial markers as well as the formal tests that were conducted. All the differences were highly significant. The Jaipur Heart Watch is another very elegant study which adds to this data. Why does this happen to women? Yes, there are several reasons for this. Could it be hormonal, biological, social, economical, cultural, or even psychosocial? There is a greater effect of glycemia on the incidence of hypertension in women as compared to men. We know the important role of dyslipidemia as far as the risk factor is concerned. Again, data from Dr. Mohan's group highlighting the low HDL in women and the hypertriglyceridemia as well. After menopause, the case that we have just discussed, she has presented to us after menopause. Look at the difference in HDL levels after menopause and look as where the LDL goes after menopause. As far as management part is concerned, I'll come to that just after the InterHeart study, which has shown us the impact of multiple risk factors on the CV risk. We lose the cardiovascular protective effect of estrogens as well. And what are the presentation differences? As it is, we know that myocardial infarction, overall clinical presentation, there may be no chest pain. Similarly, the gender differences in presentation of coronary artery disease is less in women as compared to men overall. Dr. Usha also tells us whenever she talks about heart disease, about a case who presented to her with very vague symptoms. So the most common presenting symptom is unusual or extreme fatigue. We should be aware of that, apart from sleep disturbances, shortness of breath, even indigestion. Chest pain is the least of all. And at the time of heart attack, even then the symptoms tend to vary. We should be aware of what tests are done and what are the drawbacks of imaging in women. And Can we use a simple acronym to bid goodbye to heart disease in women? Yes, reduction of risk of myocardial infarction associated with not smoking, following a good diet, regular physical activity, and moderate alcohol is very important. As far as the take-home message for the healthcare professionals, as well as the paramedics, care in pregnancy and early childhood, early detection of diabetes and gestational diabetes, and healthcare workers should also be aware of the further management. Hormone replacement therapy, Usha has already discussed this in her talk earlier. What I wanted to leave as a last message is to go red for women, which is being followed in US. So today, maybe if we had planned it in a little better way, we could have all come dressed in red, but next year perhaps we can do that. So this is celebrated on the first Friday in February, which is celebrated as Go Red Day, in which people are made aware, and this expresses their support for the awareness of heart disease. This is how one of the girls dressed up over there, and I would like to end again with the same slide which I had started with. Thank you. Thank you very much.